So Penny, come on up. What we're hoping to do is to just give you a bit of a taste for some of the projects that we've got coming up at the Western Alliance over the next few years. So if each of the presenters could move to the next seat. So Penny's first, Nick, you're second, Natasha, where's Natasha? Oh, okay, great, Penny, and Gerard, great. Where's Gerard, just to make sure? Yep, fantastic, okay. Thanks, Penny, take it away.
Okay, thank you very much, David. Okay, very quick presentation. I'm presenting on behalf of a team that makes up Ballarat Health Service staff and Federation University staff, most of whom are on annual leave at the moment, unfortunately, so that's why I'm here. So, this is a project... Okay.
Sorry, you get no bonus for technical...
All right. Okay, I'll go through it quickly. This is a very quick project that looks at an evaluation of interprofessional graduate transition program for people with a double degree in nursing and paramedicine. And the reason we're going to do this is... Okay. Is this Ballarat Health Services was the first health service to develop an interprofessional graduate program linked with Ambulance Victoria for people with a double degree. There's no evidence regarding whether these double degrees are actually equipping people well for their roles. There's no evidence of how best to support people who graduate with a double degree. And we also wanted to use it as a case study, which I will explain. So we hope that the outcome from this might inform a larger study looking at double degrees and the outcomes for the graduates. So we started off with a small team of 3. We now have actually 4. We have a novice researcher from Ballarat Health Services, Christy Waters, who's just joined the team as of yesterday, who we will mentor through this process. And for Federation University and BHS staff, we're going to use this as a case study to provide sort of a live experience of a research journey, to conduct a number of lunchbox sessions, so people are sort of walking that journey with us. And what will we do? Well, it's a very simple evaluation study. It's going to be an explanatory sequential mixed method study. We're going to use 2 phases, a graduate outcome survey, so some quantitative stats for people to look at, and then some focus groups, so some qualitative data analysis. And the things we are going to be asking people is to identify their employment status and what their preferences are after their graduate year, and the focus groups to explore their perceptions of that graduate year, and also their perceptions of undertaking a double degree and whether or not it ended up as they thought it would in the first place. So that's really it. That's my 5-minute pitch.
Less than 5 minutes, congratulations.
We'll get faster as we go on. Hi, I'm Nick van Zyl. I'm from Western District Health Services, and I'm going to briefly share with you what we would like to do between ourselves and Portland District Health with regard to medical emergency team calls. So let me just grab this quickly. So what we would like to do is to look at the before electronic observation systems got implemented at 2 sites, that's Portland District Health and Western District Health Service, or Hamilton-based hospital. What was the way of calling a med call, how was it done, and how was it managed? So in the 2 sites, and the one site is using a track and trigger system of calling a med call. This is at Hamilton-based hospital, and Portland is using a Muse, that's a multivariate early warning system, that slightly different methodology to get to the same point. So you calculate a number of parameters to get a score, and with a track and trigger, every parameter has got a line in the sand. If you go over that line, it's a med call. So we want to look at the differences between these 2, the before and after, electronic versus paper, and also the clinical compliance with these 2 systems. Oops, that was too fast. So what we're going to do is look at the implementation of med calls. Those are the kind of things that we would like to look at. I'm just briefly going to show them there. We would like to look at the outcomes. These are the impact of a med call, or what will happen after a med call. What actually the med call is there to prevent is these lot. So we're going to look at all of those and see whether there's any difference in outcomes between the two systems and between paper-based and electronic. And then we would also like to look at the compliance, looking at our policies and procedures, both sides, whether people are adhering to that or not. So what would be the outcome benefits? Well, the effectiveness of paper-based versus electronic. We need to get an answer about that. We need to look at the effectiveness of the muse versus track and trigger. And then lastly, measuring and demonstrating the compliance between these two systems and with the paper base and now with the electronic. And that's our team. Thank you.
That's terrific.
Thanks, Emma. Hi, so I'm going to talk to you about our project looking at best practice management of teenage pregnancy in rural and regional health services. And just to give you some context, I'd like to talk about 3 teenagers that presented to give birth at our health service this last year. This is not a photo of the actual teenagers, just as an example though. So the first one was a 15-year-old who presented with severe preeclampsia at 35 weeks. She went on to have a caesarean section and magnesium infusion, and the baby was admitted to the special care nursery. We had an 18-year-old who wasn't compliant with her antenatal care. She was brought in by her mother with vaginal bleeding at 34 weeks. She had an emergency C-section and had a healthy baby and self-discharged after 2 days. And we had a 19-year-old who suffered an unexpected stillbirth at 39 weeks after 3 days of reduced fetal movements, and no cause was found on autopsy. So you can see from the experiences of the teenagers giving birth at our facility that there's lots of issues affecting teenage pregnancy. There's socioeconomic and other issues such as homelessness, poor health literacy, and mental health problems, just to name a few. This age group of mothers have the highest rates of stillbirth, perinatal and neonatal mortality. The babies born to these mothers are most likely to have lower APGAR scores at 5 minutes, have low birth weights, and are more likely to be admitted to the special care nursery or the neonatal intensive care unit, which all has long-term outcomes, poorer long-term outcomes. And we know that the rate of teenage pregnancy is higher in rural areas than in metropolitan areas. And at our health service, it was in 2013 it was 14.2 per 1,000 births, compared with higher than the Victorian average. So that's kind of the motivation for our project. And also importantly, there is actually a lack of evidence-based guidelines for the management of teenage pregnancy. So there's a big gap. The aim of our project is to develop an evidence-based guideline, practice guideline, and a best practice model of care for teenage pregnancy. So we're going to do this through a number of methods: systematic review to gather the evidence and literature reviews. We will hopefully work with the peak bodies, Royal Australian New Zealand College of Obstetricians and Gynecologists and Women's Healthcare Australasia, to look at the way they develop their guidelines and hopefully follow their processes. We would like to liaison with facilities that are considered to be centres of excellence for teenage pregnancy. And then we also want to do a prospective evaluation of the management of teenage pregnancy at our health service, and also 2 rural health services, which are East Grampian Health Service and Maryborough District Health Service. So we'll look at demographic, medical, obstetric outcome data, just to look at what the risk factors are in our setting. And really importantly, we want to get feedback from the teenagers through survey and semi-structured interviews. because this is going to be fundamental to developing a clinical practice guideline that actually works. So, you know, we might say they have to attend 10 antenatal visits, but we know that they're not attending that. And so we need to understand why, and maybe we need to find either, you know, find a way that's going to help them make it to the clinic, or find another way to get them that information. So these are the outcomes. You know, the primary outcome is the development of the evidence-based clinical practice guideline and best practice model of care. We'll get a greater understanding of the barriers and facilitators to teenagers engaging with health providers and in their care during pregnancy. We think by participating in the studies that we will increase engagement of those teenagers that participate. We think once we develop this CPG and the model of care that it's potentially translatable to other geographical regions and potentially other vulnerable groups. It is already building research capacity within our clinical staff, which is fantastic, and you know, we're going to extend that to the 2 rural health services as well. We've already developed links within the health services, as I've just mentioned, and also within our team, just within our health service. And also we're working with 2 collaborators from Deakin University, Ben is one of those. And this project provides a really important foundation for future research. So obviously once we develop this guideline, we want to implement it and evaluate it, and there's a whole range of projects I'm sure that are going to spring from this. And so I'd really like to thank our team, and also to acknowledge the support of Ballarat Health Services and the Western Alliance have been fantastic in providing support.
Thanks.
Thank you.
Thanks, Gerard.
Well, hello. I'm Gerard Gill. I'm the Professor of General Practice at Deakin, and this project is around a number of my special interests, particularly about general practice workforce and around developing young researchers. We've got a team in 3 geographical locations across 4 organisations, the 2 universities, the Western Victorian Primary Health Network and the Australian Practice Nurses Association. And what we're setting out to have a look at is what's going on in our region with regard to practice nurses. Now, practice nurses have become very much a feature of Australian general practice, and it would probably be impossible to practice our modern general practice without practice nurses. But what we know about the general practice nurse workforce, similar to the general practice workforce in our region, is that it's ageing, that it probably was not properly trained for the job in the first place, and there are difficulties in maintaining skills. And so the other thing that we know is that there hasn't been much done on the general practice workforce in the last decade. There was a great burst of activity in the mid-noughties, and there hasn't been much since then. And we know with this ageing general practice workforce and with a large number of international medical graduates in our region that they're probably not going to be in practice in the longer term. And so practice nurses probably have an important role to play in maintaining primary healthcare services, particularly in the rural aspects of the region of the Western Alliance. So the problem that we set out to do is to try and identify our local practice workforce, to try and work out the need to replace them, and to try and identify what is the workload and what is the curriculum that we need to develop for practice nurses to be able to be maintained. And we're particularly interested in doing this by distance methods because looking at the economy of our region, we know that people cannot afford, with declining rural incomes, to leave rural towns and come to big centres for education. So what we're looking to do is to identify the general practice nursing workforce and its characteristics using data from the Primary Health Network, because they have a register of practice nurses, and we also have members who are from the Australian Practice Nurse Association who we'll also use to identify people. What we're then looking to do is to try and identify how old they are, get an idea from them using a survey when they're likely to think about leaving practice. The next thing we're going to do is using methodology used in the Beach project. We're going to get practice nurses, a select group of them, to record for a week what they do so that we can actually try and work out what practice nurses are currently doing. And then we're going to ask the practice nurses themselves, GPs and consumers, what practice nurses should actually be doing, because there are probably a large number of things that practice nurses should be doing that they're not currently doing because they either lack the skills or the confidence to do them. And we're going to do that using focus groups, some of which may well be telephone focus groups for those people further out, and individual interviews with selected informants. And then we're going to see, as part of this process, whether there's acceptability among practice nurses and there's actually availability of sufficient IT support for this to be delivered online, because we think that the best way to deliver this is probably electronically. And then, putting all this together, we hope that we will come up with a curriculum both for new entrants to practice nursing and also for those currently in practice so that they can maintain their competencies and their skills. Thank you very much.